Well, I became interested in epilepsies many years ago. In fact, I was interested in child neurology when I moved from Greece to London to train in child neurology. And from London, I moved to Paris, where I had the chance to meet one of the best, if not the best, child neurologist, Professor Jean Ecardi, who was a specialist in epilepsy and who always taught me that I need to be a good child neurologist before becoming a good epileptologist. And I really needed to have, so progressively I got interested to this spectrum of diseases, which in fact their clinical expression is at the same time the expression of the brain itself, depending on the zone affected by an electric discharge. And then of course came the description of the syndromes, of the EEG, the evolution of the MRI, the epilepsy surgery, and the increase in number of drugs, the introduction of neuropsychology, and this really became a field that interested me more and more and more. And of course, as I know, as everybody knows, I finally remained in the epilepsy field, although I still do general child neurology whenever needed. So epilepsy care in France has, in my eyes, an important advantage, is that for the last 15 years, if not more, we developed national networks for epilepsy care. What national networks are? We have epilepsy reference centers that have practically all the necessary technical tools and competencies. They are often understaffed, unfortunately, but at least they have access to the best technologies, and they work in very close relationship with smaller centers. And this allows, in most of the cases, an early diagnosis of the types of the epilepsies, or if this is difficult because we don't have the diagnosis, at least we can share what we know with other colleagues in the field. So I strongly believe that this is a big asset for clinical epileptology, to develop in each country, in Europe at least, national networks where the bigger centers that are indispensable work closely with the smaller ones. And this is probably one of the best lessons I learned in France. Although, of course, there are still many things to be ameliorated, developed, particularly increase in medical staff of these departments to better answer to the patient needs more promptly, and also to be able to treat them or cure them depending on the type of epilepsy, and so that they can have a better life after being taken care at an appropriate center. So, neurologists, or what we call adult neurologists, because I am a child neurologist, know already quite a lot about the epilepsies. Their first strong point, first of all, is that neurologists are in general well trained in neuroanatomy. They know the localization of the brain, they know the different symptoms. I would say sometimes much better than child neurologists or pediatricians. But on the other hand, because many of these children with epilepsy will go on having epilepsy later in life, particularly the very severe neurological diseases with epilepsy, but not only. I think that the first thing an adult neurologist dealing with epilepsies that started in childhood is to know very well the age component. When did the epilepsy start? At what age? With which symptoms? And reconstruct the history, how it evolved in the first years. That's the first point. The second point, I think they need to know, particularly because many of these children arrive to them with 3, 4, 5 drugs at a time, is to be knowledgeable in drug interactions and try to reduce the drugs before start adding new drugs. Otherwise, it becomes very complicated, and I would say this at the same level as the pharmacology, be able to go back to the neuroimaging or ask even for a new neuroimaging, because a lesion could have been missed when the patient was a child, even a small lesion, and this patient can be treatable not by drugs but by surgery, and this would be important not to miss. And at the end, because we are entering now the period of precision medicine, of targeted therapies, we need to construct with the adult neurologists cohorts of patients where we have the genetic data. When a patient started an epilepsy in childhood, the chances that it is a genetic form, if the seizures still persist in adulthood, are quite high. So they need to be screened appropriately to see if it is or not a genetic epilepsy, because this will influence the treatment and the prognosis in the years to come. It is not only for research, it's also to adapt the treatments in the future. Thank you.